Hello, and welcome to the Tri-City Laser Light Therapy Clinic. We're going to spend the next 25 minutes learning about laser light therapy and what this exciting new technology can do for you. Our mission here at Tri-City Laser Light is to eliminate pain, to reduce or eliminate the need for pharmaceutical medications, to restore normal range of motion, and to improve our patients' quality of life. This new technology we're using is called low-intensity laser therapy or laser light therapy and can be used for a wide variety of painful conditions. The use of laser light therapy has been medically licensed in Canada since 1995, but the technology has come to us from Russia and Japan, where it has been in use for the last 40 years. So although laser light therapy is relatively new to Canada, it has been tested and proven over quite some time. You may have heard this therapy referred to by a number of different names, as seen on this slide. We call it laser light therapy, but all these terms refer to the same basic technology. What are the advantages of laser light therapy? As you can see, there are many, but we like to emphasize three. Laser therapy is non-toxic, non-invasive, and there are no side effects. To repeat, there are no side effects. In over 3 million treatments in Canada, there has never been a single adverse event recorded. This is definitely superior to many of the pharmaceutical remedies that are currently available for pain, and while painkillers do provide some relief, used over the long term, they can cause harmful side effects such as kidney or liver damage. Laser therapy is non-toxic, non-invasive, the treatments are not painful, and it provides rapid healing and a rapid reduction in pain. How does it work? The BioFlex laser we use produces 3 different wavelengths. These wavelengths produce photon energy. Photons are small particles of light that are absorbed into the cells at the molecular level, where they are transformed into biochemical energy, enabling the cell to heal. What the patient experiences as a result of this treatment is a reduction in pain, a reduction in inflammation or swelling, an increase in range of motion, and a rapid acceleration of the healing process. With laser stimulation, we're able to promote rapid repair of superficial skin wounds and burns, as well as repair of deeper tissues such as torn muscle and tendons. This is a picture of the interior of a typical cell. On the left side of the cell, the kidney bean-shaped organelles with the yellow squiggly material are the mitochondria, which produce ATP. ATP is the fuel that powers all the cellular functions, similar to the way gas would power your car. Laser stimulates the mitochondria to speed up the production of ATP, resulting in an increase in the metabolism of the cell. It goes faster, just as your car would if you provided more gas. Laser light activates an increase in the cell's ability to absorb nutrients and accelerates the cell's metabolism, which results in a faster healing cycle. Cells respond to laser light therapy in many ways. Among the most important effects of the laser therapy is an increase in new blood vessel formation called angiogenesis. This increases blood flow to the damaged tissues. Beta endorphins are also released, which are the body's own natural painkillers. We also see a release of beta cortisol, which is the body's own anti-inflammatory. Laser stimulates the rapid synthesis of proteins and DNA, the building blocks of the cell, and this all results in that acceleration of healing. What conditions can we treat with laser light therapy? We can treat acute injuries such as muscle tears, tendon tears, ligament sprains and strains, and even fractures. We can treat all the musculoskeletal conditions such as repetitive strain injuries, carpal tunnel syndrome, rotator or shoulder cuff tears, and so on. We can treat inflammatory conditions including all the itises, tendinitis, bursitis, fasciitis, rheumatoid arthritis, and the degenerative disorders that have been so slow to respond to traditional medical treatments. Yes, we can treat arthritis, and in our office that's probably our biggest patient use. Other applications of laser therapy include dermatology, gum disease, plantar fasciitis, and biomechanical problems. Wound management is a particularly popular and exciting application, providing healing for burns, post-operative scars, and diabetic ulcers, for example. Now let's go to some of the pictures, as these will give you a good idea of how the technology can help for a variety of painful conditions. Some of these photos are quite graphic. For those of you with squeamish stomachs, I apologize. Please feel free to close your eyes if the photos disturb you. Our first profile shows a 7-year-old boy who has suffered a painful second-degree burn from a motorcycle exhaust pipe. A burn of this nature would normally take 6 to 8 weeks to heal and most likely leave a permanent scar. But as you can see from the picture on the right, after 5 treatments over 8 days, the burn is gone and the wound has healed without any scarring. So instead of 2 months of painful recovery, this boy is fully recovered after only 8 days. This young man, a weightlifter suffering from a sore shoulder, fell asleep with an ice pack on his shoulder and was burned by the ice. Yes, you can develop a burn from ice, and it's equally painful to a burn from heat. He received 2 treatments over 3 days, and the second picture shows you that the burn has completely resolved. This gentleman has diabetic neuropathy, which has left him with a loss of sensation in his feet. While on vacation in Hawaii, he walked barefoot on burning hot pavement, but did not feel the heat due to his diabetic neuropathy. You or I would have felt the heat, but because of his lack of sensation, he sustained second-degree burns. The picture on the left shows his foot after 6 months of traditional wound care. During this time, he was unable to work, and a public health nurse had to come to his house every day to clean and dress his wounds. After 6 months of this traditional wound care, he had no improvement and became a candidate for amputation. Instead, he came for laser treatment, and after 19 treatments over 1 month, you can see from the picture on the right that he has just a small scab remaining, and there is no longer any need for amputation. This patient had a partially torn Achilles tendon. In the pictures on the left, you can see a bulge over the Achilles tendon just above the heel and a loss of definition looking at the heel from the back. These tendon tears in the Achilles are very slow to heal. The normal course of healing is between 3 to 6 months, and because of the way the tendon heals after a tear, with the fibers going at all different angles, there is a high risk that the patient will re-tear or re-aggravate this injury. If you look at the pictures on the right side of the screen, you'll see that after 10 treatments, that bump over the back of the heel is now completely gone, and proper definition has returned. No more swelling, no more inflammation, fully restored range of motion, and no pain. In addition, the fibers in the tendon have healed in their natural lengthwise alignment, and so there is no scar tissue, and the risk of re-injury is significantly reduced. With laser treatment, we can heal any partially torn ligaments or tendons. If the tear is a complete tear with no intact fibers, surgery will be necessary. Here on the left we have a simple muscle tear with a bruise or hematoma. Normally, left untreated, this would take 3 to 4 weeks for the bruising to heal and for the muscle underneath to be feeling better. The patient was given 8 treatments over 2 weeks, and you can see that the bruising and swelling have gone, and this muscle tear is now completely healed. So using laser light therapy, we were able to reduce the healing time by about 50%. This slide shows a tendon injury affecting the biceps femoris muscle on the back of the knee. Very tender and sore, as you can see from the bruising, inflammation, and swelling. Normally this would take about 3 months to heal, but on the right we have, after 4 treatments over a 1-week period, complete resolution of the tendon injury. This next profile is a much larger tear, a hamstring tear. Anyone who has experienced one of these knows exactly how painful they are. Every step is in agony. Walking and driving are agony. Hamstring tears normally take 3 to 6 months to heal, but with just 3 laser therapy treatments over only 5 days, you can see complete healing of the muscle tear. The bruising is gone, but more importantly, the muscle underneath is healed. This young man wrenched his arm while skiing and sustained a muscle tendon injury which typically requires 2 to 3 months to heal. Again, you can see that after just 4 treatments over 9 days, the bruising is gone, the inflammation is gone, and the muscle and the tendon are healed. This profile is another hamstring tear, and you can see by the extent of the bruising that this is a fairly large tear. Again, these injuries are extremely painful and usually occur when an athlete is not fully warmed up and asks for heroic movement from his muscles. In this case, we have a soccer player who gave a vigorous kick before his muscles were warmed up, resulting in this injury. Instead of the usual